Secretary McDonough, you're on the first panel. We're going to hear from the VA on why they believe this budget is appropriate and how it will enable them to support the veterans in FY23 and beyond. On the second panel, we're going to hear from VSOs, Veteran Service Organizations, who wrote this year's independent budget. Each year, the independent budget offers an informed perspective on what the VA needs to live up to the promises our nation has made to our veterans. Right now, their voices are more essential than ever as we work to get the comprehensive toxic exposure legislation across the finish line. Now, I want to introduce Secretary McDonough, but first, and more importantly, I want to introduce his daughter, Addie, and his niece, Grace, who are in the audience. It's good to have you here, ladies. And it should be an interesting meeting. You get to watch your uncle and father get totally questioned to the ground, so it's good. Secretary McDonough, the floor is yours.
Mr. Chairman, thank you. Ranking Member Moran, thank you very much. Thanks in particular for expressing the welcome to my family, about whom I'm very, very proud. With your consent, Mr. Chairman, and with the ranking member's consent, I'll just submit my opening comments for the record. We get straight into questions. Great.
The FY23 request includes resources needed to process newly announced presumptions to include asthma, sinusitis, rhinitis. Is that correct?
That's correct.
Does it include the rare cancer presumptions?
It does.
Okay. How many claims from asthma, sinusitis, and rhinitis does VA anticipate for FY23?
For FY23, for those three, we anticipate 100,144 claims and about 69,886 appeals. So that's a workload of around just over 170,000 cases. On the rare respiratory cancers, we think that these, since we call them rare, we believe the claims will be rare. So we think that those will be accounted for in our overall request.
Okay. If we're able to pass the Sergeant First Class Heath Robinson PACT Act, which has less than a quarter of the claims in FY23 that you anticipate for the three that I just mentioned, asthma, sinusitis, and rhinitis, what kind of resource support would you need?
Well, we're running that through our process right now, Mr. Chairman, so I don't have a specific number for you, but we've been looking at a series of enhancements under existing authorities and existing dollars to get ready for this.
Yeah.
So from automation to hires, we're in the process of hiring over 2,000 additional claims personnel, to potential contracting and claims process improvements. We think that we'll be in a good position to handle that in the first year.
As far as workforce goes, this budget requests $42.2 billion for medical service staffing to provide for 282,789 FTE, an increase of just over 14,000 over last fiscal year. However, we've heard from the VA about the difficulty of recruiting and retaining healthcare providers in this labor market where anybody can get two jobs if they're looking for one. Is the requested funding level adequate, given that the latest data, although it was challenged the last hearing we had, but given the latest data shows 56,000 vacancies at VHA?
Yeah, our request includes all the necessary funding for the needs that we see in the system for FY23. So we think that the funding for the healthcare personnel is up to date and is sufficient. We think, though, as we've discussed in this room, and you and Senator Moran have been generous enough to provide in the context of your agreement, that we need additional authorities to enhance pay in certain instances, to enhance retention capability in certain instances. So it is true that it's a very tight, very dynamic labor market, especially for healthcare personnel. But we think that you, both in the President's request and in the authorities that you've given us, that we'll be in a position to handle it. Notwithstanding the fact that that aggregation of vacancies over time continues, but we do this year by year to make sure that we have the people that we need.
Okay. The FY '23 revised request includes an additional $4.3 billion in community care funding. My understanding is this funding level is driven in part by a lack of administrative staff and support necessary to execute in-house dollars. Correct me if I'm wrong on that.
That is a variable in the equation. Probably the more impactful variable in that equation is use, mostly because of pent-up demand in the system, and greater eligibility because of the way we handled the pandemic. And so, yeah, our ability to manage more quickly and get people into care more quickly is obviously impacted by the tightness of the labor market. That's why the President's request does ask for additional HR personnel, and why we continue to ask you for the authorities that you have included in the PACT Act.
Okay, the Caregivers Program funding budget asks for $1.9 billion, which is $433 million increase over last fiscal year. However, the VA recently halted discharges from the program and expansion to veterans of all areas and is scheduled to begin it in October 22.
Yes.
So is the requested level of funding adequate to provide for the influx of applicants and participants that quite frankly are expected and I hope occurs in the caregiver program?
Yes, we believe it's adequate, and we're hoping for the same thing that you're hoping for.
Okay. I'm going to turn it over to Senator Moran for his questions. I'm going to also turn, because I don't know what Jerry's schedule is, I'll turn the gavel over to Brown, and I'm going to go see a doctor.
Okay. Godspeed.